أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Today the topic which we are going to discuss is dental caries. We'll take a review of etiology, pathogenesis, risk assessment, diagnosis, prevention, treatment and prognosis. Now at the end of this lecture we should be able to define dental caries, explain the etiology and pathogenesis, describe cariogenic microorganisms, discuss risk factors, classify dental caries, diagnose carious lesions, explain prevention strategies, discuss treatment options, and understand prognosis and recent advances. We will divide this topic into 2 to 3 parts. Today we are going to discuss what is dental caries. According to WHO, dental caries is a localized biofilm-mediated sugar-driven multifactorial disease resulting in the demineralization and destruction of dental hard tissue. In easy words, it is a chronic infectious disease which is characterized by destruction of enamel, dentine, and cementum. And this destruction is caused by acids produced by bacterial fermentation of dietary carbohydrates, basically sugar. Sugar is the main culprit of caries and of destruction of enamel, dentine, and cementum. Now, why is dental caries important? Because it is most common oral disease worldwide. It is one of the most prevalent chronic diseases. It affects all age groups. It is the major cause of tooth loss. The tooth loss is the advanced stage which starts from the pits and fissure caries. It impairs mastication, speech, and aesthetics. And if it is not treated at the right time, it results in significant economic burden. Nearly 2 billion adults have permanent tooth caries. More than 500 million children have caries in primary teeth. Higher prevalence in low and middle income countries, and it has strong association with socioeconomic status also. Now let's see let's learn something about tooth anatomy: enamel, dentine, cementum, and pulp. Now, the first outermost part is enamel. Underneath enamel is dentine. This red tissue is pulp, and these yellow ones are the periodontal ligaments. Now, first of all, the caries starts with enamel, this white portion. Then it proceeds to dentine if untreated. Now this is the pulp. This is the pulp. When it reaches the pulp has all the blood vessels and nerve tissue. When it reaches the pulp, the pain is unbearable. And all this surrounding tissue, the bone, the gingiva, this all constitutes the periodontium. And when it goes into the infection, if infection spreads into the apical area, it results in the apical periodontitis, and it is very very painful. ठीक है, तो हमने we have to stop the caries at this point. This is the point where we have to stop the caries, inshallah. Now, what are the cariogenic microorganisms? The major microorganisms which are involved in caries are Streptococcus mutans, Streptococcus sobrinus, Lactobacillus, Actinomyces. Now, Streptococcus mutans is the primary initiator of enamel lesions due to high acid production and adhesive capabilities. जो मेन कैरियोजेनिक स्पीशीज है वो है स्ट्रेप्टोकोकस म्यूटेंस. Lactobacillus species, they thrive in deep established cavities and accelerates the progression of existing lesions. Once the cavity has spread, it's deep, then the Lactobacillus species they accelerate the progression of lesions. Actinomyces species, they are prominent early colonizers involved in root surface caries and plaque maturation. When the caries proceed to root surface, then the Actinomyces species play their part. Now, the bacteria and germs our bacteria is already present in our environment, in our healthy oral environment. But when bacteria and germs are mixed with food, drinks, sugars, and sweets, the acid is produced. And as you know that the junk food contains germs also, so when the acid is produced, तो healthy tooth में जब acid आता है तो acid causes cavity. As you know that acid is very harmful. तो होता ये है कि जब बैक्टीरिया और फूड और ड्रिंक्स शुगर वाली शुगरी फूड के साथ, कार्बोहाइड्रेट्स के साथ, ज़्यादा शुगरी जो फूड होता है उसके साथ जब ये बैक्टीरिया और जर्म्स मिक्स हो जाते हैं और एसिड प्रोडक्शन हो जाती है तो फिर हेल्दी टूथ में कैविटेशन हो जाती है. Now what are the stages? So the first stage to the formation of caries is biofilm formation. How does biofilm formation occurs? These are the stages: acquired pellicle, initial colonization, secondary colonizers, biofilm maturation, and acid production. Now, acquired pellicle formation. It forms within minutes on a clean tooth surface. It is composed of lively proteins, glycoproteins, and lipids absorbing onto enamel. It acts as a conditioning film that prepares the tooth for bacterial binding. ठीक है, clean tooth surface पे pellicle formation within minutes हो जाती है. जब आप whenever you eat something and the tooth is clean, the pellicle is formed. Pellicle basically provides a film, where bacteria will attach to the tooth. Now, next stage is initial attachment, early colonizers. This occurs within hours of pellicle formation. Mainly Streptococcus and Actinomyces species, they attach weakly and then they bond securely through adhesions and fimbriae. Stage number 3 is matrix formation. Now these bacteria, they multiply, they make a bundle and they multiply. And then the microbes secrete an extracellular polymeric substance, EPS, or slime layer. This sticky matrix anchors the community and shields it from antimicrobial agents and host immunity. Now, what happens is when the bacteria, they multiply and they make a big group of bacteria, then these microbes secrete a protective layer for themselves, which is a slime layer. And this sticky matrix, it shields the bacteria from the immunity of host and antimicrobial agents. So within the hours जो है हमारा immune system काम करना छोड़ देता है. Now, biofilm growth and architecture. Colonies multiply, increasing thickness and mass. Cell to cell communication develops, complex structure organization हो जाती है. फिर ये biofilm mature हो जाती है. It reaches a stable, fully functional multi-species ecosystem. And then they find in oral cavity, they find different sites और वहाँ पे ये caries करती हैं. Now you can see this is the bacteria जिसकी attachment हुई है. Once a microcolony is formed, ठीक है, तो ये एक slime layer protective इधर आ जाएगी. ये पीछे नीचे slime layer आ जाएगी. ठीक है, उसके बाद ये मैट्रिक्स बन जाएगा. फिर जब मैच्योर हो जाएंगे सारे, तो ये सारे बैक्टीरिया जब डिस्पर्स होंगे तो डिफरेंट जगहों पे जाके तो कैरीज करेंगे. ठीक है, टिल फॉर टुडे दिस इज़ इट. यहाँ तक हम रखते हैं कि हमने देखा कि कैसे कैरीज बेसिकली, कैसे बैक्टीरिया जो है वो कैरीज करते हैं, कैसे बैक्टीरिया आते हैं. हमारे बिल्कुल क्लीन टूथ सरफेस होगा, हमने ब्रश किया हुआ है, वी हैव ब्रश्ड आवर टीथ, क्लीन टूथ सरफेस, हमने कुछ ऐसा खाया, द पेलिकल इज़ फॉर्म्ड. नाउ टू प्रिवेंट कैरीज इट इज़ नेसेसरी कि आप जब भी कोई शुगरी चीज़ खाएँ, कोई मीठी चीज़ खाएँ, इवन कि आप आफ्टर एवरी मील यू शुड, if not brush your teeth, you should at least gargle. ठीक है, आप कुली करें, कुली करके अच्छे तरीके से अपना जो है ना वो साफ़ कर दें. जस्ट क्लीन योर माउथ. ठीक है, एंड आफ्टर नाइट मील, बिफोर स्लीपिंग, you need to toothbrush every day and in the morning. आफ्टर नाइट इट इज़ वेरी इंपॉर्टेंट. आपने खाया हुआ है, अगर वो रात को रहेगा, पेलिकल फॉर्मेशन होगी, वैसे भी सलाइवा कम प्रोड्यूस होता है, बैक्टीरिया के एडहेसिव होने के और अटैच करने के चांसेस बढ़ जाते हैं. सो नाइट टाइम ब्रशिंग इज़ वेरी इंपॉर्टेंट फॉर द हेल्थ ऑफ टीथ. ठीक है, थैंक यू सो मच. जज़ाकल्लाह खैर. वी विल कंटिन्यू इट इंशाल्लाह इन नेक्स्ट सेशन.